Hey guys, this is Hamdan from Drbeen. Today we're going to be talking about the relational terms for anatomy. In anatomy, it is essential to describe the location of various structures. This is usually done by comparing the position of one structure in relation to another. For example, the lips are in front of the ears, the toes are in front of the heel, the big toe is on the inner side of the toes, and so on and so forth. But for now, let us review the terminology used to describe these relations. To start is anterior. Anterior structures are structures that are towards the front. For example, the lips are anterior to the ears, the toes are anterior to the heel. Now, anterior also refers to structures placed towards the front of the body. For example, the eyes are located anteriorly on the head. Posterior is the opposite of anterior, used to describe structures that are located behind another structure, or that are located on the back side of the body. An example are the ears, again, are posterior to the nose. Medial is used to describe structures that are towards the median plane. And as you remember from before, the median plane means toward the center of the body. So now, medial would mean toward the center of the body compared to another structure. For example, the big toe is located medial to the other toes, or the heart is medial to the lungs. Lateral is the opposite of medial. This is used to describe structures that are located away from the center medial line of the body, or away from another structure that is located towards the middle of the body. For example, the small toes are lateral to the big toe. Superior is used to describe a structure located above another structure, like the eyes are located superiorly on the face compared to the lips or the nose, or the lungs extend superiorly in the chest compared to the heart. Inferior is the opposite of superior. This is used to describe a structure that is located below the other structure, or a structure located away from the head. For example, the lips are placed inferiorly on the face compared to the eyes. Or, the diaphragm is inferior to lungs and the heart. Ventral is related to the underside or abdominal side. In humans that stand up straight, now remember that, stand up straight, the abdominal side is also front, so ventral and anterior is usually used interchangeably. However, in other animals and in developing humans, this may not necessarily be the case, so just keep in mind that ventral means toward the abdomen, regardless of where the abdomen is. Dorsal is opposite to ventral. It is used to describe structures that are located towards the back compared to another structure, or away from the abdomen. For example, vertebrae are dorsal to abdominal viscera. Again, in humans, dorsal and posterior can be used interchangeably. However, in developing humans, the distinction between dorsal and posterior should be correctly understood and used. Cephalic and cranial means toward the head or cranium. Just like ventral and dorsal, in humans, cephalic and superior can be used interchangeably. However, in the developing human, the distinction between superior and cephalic should be understood. And finally, caudal is used to describe structures that are towards the tail compared to other structures. For example, the lumbar vertebrae are caudal to thoracic. Again, this term in other animals and developing humans can mean differently than the term inferior. So now keep in mind that as you go on, you'll most of the time mix these terms together to help describe structures in relation to other structures. For example, the big toe is located anteromedially on the foot. And what that means is that the big toe is in the front and on the inner side. This concludes today's lecture. Have a nice day.